Good evening, class, professor, everybody watching this. Keanu Green back with video essay questions. This week we are on bones and the appendicular skeletal system. I know it sounds like I'm very good, but it actually is kind of cool. So we had some scenarios. Well, I had a couple scenarios to run through, and I had to come up with a sense for them in a little. And it will tie in with the skeletal system. So let's start it. So the first scenario is your X-ray exam reveals that you have a fractured fibula. The physician remarks, "Well, it's better than breaking your tibia." I had to explain why a fracture of the tibia would be worse than a fracture of the fibula. So the reason why fracturing your tibia versus the fibula fracturing your tibia would be better than fracturing your fibula is because your tibia actually helps support the weight of the fibula. The fibula is the smallest bone on the side of your leg. The tibia is the main one that takes most of the weight bearing. So, snapping your fibula, sorry for that, there's not enough tissue on the fibula. So because of this, it is easier to break and lead to a fracture. Hence why it's not a good thing, because this can also, open fractures can leave you more susceptible to infection. So fibula, no bueno. Yes, a fracture is still bad, but at least if you fractured your tibia, it wouldn't lead to much more underlying causes and or consequences coming. So there's that. Next one is an individual with very low levels of vitamin D presents themselves to complaining of seemingly fragile bones. Why, you might be asking? So vitamin D, if you ever realize, is actually the thing most people say you get from sunlight. So it's supposed to be very important to bone mass and bone marrow. Here's the reason why. I bet you didn't know vitamin D is actually needed to help your stomach absorb calcium. So calcium is it's the protein that's the nutrients that you can receive from drinking milk or lactose-involved products. Now, with low levels of vitamin D, this leads to low levels of calcium moving through your bloodstream. So calcium has to move through your bloodstream that's why people will say if you drink milk, you have strong bones. The reason being is because calcium is constantly moving through your bloodstream to strengthen the bone marrow itself. Now, with low levels of calcium in your bloodstream, this would cause the calcium to actually be released through your bones. And with these reduced levels, it can cause your bones to feel weaker. You will physically feel like your body is weak. And that's not good, because a weak bone marrow can actually lead to higher risk fractures. High risk fractures are never a good thing because, of course, that would cause hospitalization, possible infection. Nothing good comes out of it. So, take the vitamin D. Point blank, period. So, last but not least, we have a little space scenario. So, during the early years of space exploration, our astronauts who had been floating in space would return to Earth showing significant bone loss depending on how long they were in space. I get to explain how this happens. So, astronauts, of course, if they are constantly stuck in a space station for up to about a year to longer years, so on and so forth. The reason being is because, now, you're in a low gravity scenario. This is why they prepare astronauts to be used to low gravity scenarios, because the gravity actually increases your bone mass. So it's going to feel weird. Now, it's going to feel even weirder when you have to come back to Earth, because since you were in such a low, borderline, non-existent gravity scenario, you come back to Earth and the gravity is very existent, you will feel it, which will cause a serious loss in bone mass. Not good, because once again, as we previously talked about, low bone mass will actually have you feeling weak. Can also, will also maybe lead to sickly feelings. So what's the best way to possibly alleviate this condition? My theory is that the best way possible is to actually put all the astronauts that had just come back into a controlled area. Monitor them so that way they can actually go back to being used to feeling the Earth's gravitational pull, but also provide them with a proper intake of vitamin D and potassium, which will allow their bone mass to increase back to normal levels, so that way they won't feel as bad. I know it sounds really simple and not as sciencey as I wish it could be, but I think that's the best option. Now, is that what they actually do? I don't know, but NASA, call me up if you want to know. And yeah, that's the end of it.